Hi friends, welcome to classes by Lab Doctor. In our previous classes, we have studied about the prothrombin time, and there is another factor called as International Normalized Ratio, what you see on the blood report. So in today's class, let us discuss about this International Normalized Ratio. International Normalized Ratio is a standard measurement of blood clotting. I've told you that this PT value can vary from lab to lab. Okay, and when we have put a patient on certain anticoagulants, we are monitoring them. We want to know exactly what is the status of their blood clotting. We need some standard process, and to standardize this measurement of blood clotting, what we have is this INR. It is a ratio that is calculated from the prothrombin time test, and this compares your clotting time to a normal standard. Okay, this becomes very important when a patient is put on warfarin or other anticoagulants or blood thinners, wherein this we monitor the INR value. Okay, higher INR value, if you are getting higher INR value, that suggests that you have a tendency of bleeding, and if the INR value comes lesser, then there are chances that your blood might be clotting. So now why this INR is used? Because of standardization. That is, before INR, PT results varied widely between different labs, and the test also was varying so much that it was making hard for the clinician to compare them. So this INR provides a universal way to understand these PT results. And secondly, I have told you for monitoring the anticoagulation. So it's used to ensure that the people who are taking this blood thinning medicines like warfarin, they have this INR within a safe and effective therapeutic range. Okay, so the INR for people who are on anticoagulants is different, and for a normal individual the INR is different. So when the doctor puts a patient on this blood thinners, he sees that this INR is maintained in a particular effective and safe therapeutic range. So now how will you define this INR? Okay, or how will you calculate this INR? So this INR is nothing but it is this patient's prothrombin time and the normal mean PT, which is raised to the power of the International Sensitivity Index. So what is this International Sensitivity Index? This is a correction factor. Okay, it is a correction factor which is assigned to the thromboplastin reagent. So INR calculation is nothing but what is the patient's value, what is the mean normal PT raised to the power of International Sensitivity Index. So this ISI usually is between 1.3 to 1.5. So this when you are getting this so now what is this ISI or International Sensitivity Index? So you all know when you do a PT test you need this thromboplastin reagent. So now this ISI will measure and reflects how sensitive a particular thromboplastin reagent is in a prothrombin test. So this is calibrated against the World Health Organization International Reference Thromboplastin. Reference thromboplastin has an ISI of almost 1. Okay, so lower or the ISI which is closer to 1 indicate that it is more sensitive. The more further away it goes from 1, it signifies that this is less sensitive. So we should have a ISI which is closer to 1, that is more sensitive, and it would give you a more accurate results. Okay, so this ISI is a standardized measure which sees that the thromboplastin reagent whatever is used, that is quite sensitive up to the WHO international reference standards. When I say INR, it is patient's PT divided by the mean normal PT raised to ISI. So this, you know, mean normal PT you will be calculating by taking an average, and then the ISI which I have told you in the last slide. So suppose if the patient's PT was 20 seconds and the mean normal PT was around 12 seconds and the ISI is 1, which has to be very close to 1, the INR of the patient on calculation would come to 1.5. Normal prothrombin time is between 11 to 14 seconds. Okay, and in a healthy individual we expect the INR to be around 0.8 to 1.1 who are not on any kind of a blood thinners. Okay, but when we put a patient on certain anticoagulant etc., we expect that the INR is higher. That is, it between 2 to 3 times the control value. So you will see that in various conditions the INR will be different, and this 2 to 3 is a normal range what the doctor expects when he is put the patient on blood thinners. If at all the INR value goes more than 5, then it is a critical value. So INR more than 5 has to be immediately informed to the clinician. Similarly, your PT more than 30 seconds is very critical. The patient might bleed. Okay, so this has to be informed to the clinician and the patient has to be attended immediately. INR, the normal range would be 0.8 to 1.1. Okay, so when I say INR is equal to 1, that represents equal to normal clotting time. INR is equal to 2 means it represents twice the normal clotting time. INR is equal to 5 means it represents 5 times the normal clotting time. So this is what you have to understand. There is no unit for this INR, it's a ratio. So when I say INR is equal to 2, that means it is twice the normal clotting time. Okay, and if it is coming as 1, that is normal. That is the normal clotting time. So that is why 0.8 to 1.1. So that is normal. If it is coming 2, then it is twice the clotting time. If it is 5, then it is 5 times the clotting time, which is very dangerous. So the normal range would be 0.8 to 1.1. Okay, now in INR which we monitor for oral anticoagulants, we will see that there are various conditions and depending upon that the doctor will monitor the INR. So if the patient is having deep vein thrombosis or if there is for a DVT prophylaxis etc., we will see that the INR is between 2 to 3. In pulmonary embolism, in prosthetic valve prophylaxis, with atrial fibrillation. So the doctor monitors this INR and he sees that usually in such patients it is between 2 to 3 or 2.5 to 3.5. What do the results mean? I have told you that if I say INR of 5 means it is 5 times more than the normal clotting time. So if you are getting a higher INR, your blood is taking longer time to clot. So you have a tendency of bleeding. There could be internal bleeding also, and that can endanger the life of the patient. If it is lower INR, it says that the blood is clotting more quickly. That means the patient is having more tendency of forming a clot. Okay, so that is the meaning of low INR. Okay, for healthy individuals, it should be between 0.8 to 1.1. And if we are putting them on warfarin or any blood thinners, we usually expect the INR value to be 2 to 3 times the normal value. So here now we get this home monitoring kits for PT INR. They are very easily, you can handle it, you can monitor. You will have to monitor the PT INR regularly, especially if you are on this blood thinner. So it is very comfortable. It is budget friendly also. So there are various factors that can affect your INR. One is medication. So there are various other vitamin supplements, your cold medicines, etc. They can interact with the warfarin and they can affect your INR. Certain foods like your green leafy vegetable like your spinach, cranberry juice, all these can also influence the INR. So the spinach, they are rich in vitamin K. They can lower the INR, whereas this cranberry juice, they can increase the INR and risk of bleeding. Yes, so diet can also vary your INR. Hence, you need to also discuss about your diet when you are taking these blood thinners. Certain other health conditions, suppose you are having liver disease or you're having a vitamin K deficiency, your kidney problem, etc. That can also influence your INR. And other lifestyle changes like your stress, your exercise, your alcohol intake, that can also influence your INR. So whenever you are on any kind of a blood thinners and your doctor is monitoring you, remember it is just not the medicines. There are other factors also, like your diet, your exercise, your stress, your alcohol consumption, etc., which can alter your values. So what are the signs of elevated INR? I've told you increased INR means blood is taking more time to clot. So patient will have easy bruising. Without any clear injury, he will have bleeding, and the cuts will take long time to heal. There will be bleeding gums. There might be nose bleeds. So these will be the symptoms of increased INR. How do we treat this increased INR? So now the treatment actually depends on how severe your bleeding is. If you are on an anticoagulant medicine, your doctor is going to alter your dose, or he might see that your further doses are skipped for some time, and he will follow you up. Sometimes vitamin K is given so that it decreases the tendency of bleeding. Sometimes even we might have to give blood components also to reduce your bleeding. So now, how can I prevent an elevated INR? What you can do, one thing is you will have to monitor your INR regularly. At least once a month your INR has to be monitored. I've told you now there are home devices, you can easily monitor it, and you will have to definitely do this. You will have to take your medicines as directed by your physician. Okay, whatever supplements you are taking, herbal medicines you are taking, other preparations you are taking, you all those things have to be told to your doctors, because they can also interact with your blood thinners, and they can also change your INR. So please discuss your medications with your doctor. Discuss about your diet with your doctor, because I've told you certain vegetables like spinach, etc., can alter your INR. So please discuss with your doctor what are the foods you are having, whether you are having what type of vegetables you are having, fruits you are having, and whether it is safe to consume with these medications. It is always better to limit alcohol and smoking, because it leads to hypercoagulable state. Okay, so you should contact your doctor whenever, if you feel or if you see certain symptoms, like you're seeing blood in the urine, or you are seeing blood in your stools, your periods have become very heavy, and you are bruising, you are bleeding for no injury, or no very very minor injury, you are bruising, cuts are taking longer time to heal, you are having pain in your joints, sometimes you feel headache, or you're feeling very giddy, and you are having vomiting sometime, and that is a coffee ground vomiting or blood in the stool, etc., immediately you will have to discuss and consult your doctor. Remember, with INR or when you are on an anticoagulant, always discuss with your doctor, and keep monitoring your INR. Monitoring is the key. You should do it very consistently. Understand at what range your INR has to be there, and follow your doctor's instruction. So these were few things about INR. Okay. So thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.